How accurate are lung sounds? In 2020, a group of actual scientists with actual higher ed degrees wondered the same thing, and they conducted what is known as a meta-study. This means they didn't conduct any of their own original research, but instead looked at the research in 34 other studies about lung sounds. And we are fine with this. Meta-studies actually tend to be more valuable and accurate than studies that just look at one set of original data because inherently their sample size is so much larger and the methodology is so much more varied. Furthermore, this paper was cited 37 times, which is completely respectable and indicates to us that we should take it at least kind of seriously. So what's the conclusion? How accurate are our lung sounds? It kind of depends. Briefly, let's talk about what specificity and sensitivity mean. Does X indicate Y? In this scenario, it would be do rails indicate pneumonia. Specificity refers to the circumstance where X definitely exists. The rails are factually there. Sensitivity refers to the circumstance where Y definitely exists. The pneumonia is definitely there. How can you ever keep track of what these two things mean? I recommend that you don't. Just Google it. I get these two things mixed up all the time. You can also skip that part. You can just know that higher numbers, the closer it gets to 1, the better the assessment is, and refuse to understand it any more than that. I support that as well. So for pneumonia, it's 0.9 specific. What that means is if you can hear rails on a patient who has a history consistent with pneumonia, there is a 90% chance they have pneumonia. So, yay, confetti, we're done. Hold your roll, slow it down. It's only 0.3 sensitive. That means if I show you a patient who factually, provably has pneumonia, it's on their chest x-ray, it's in their blood work, whatever, there is only a 30% chance that you will be able to hear the rails. The fluid is factually there. And it doesn't matter if you have a digital scope. It doesn't matter if you've listened to 30,000 of lung sounds. The sound just isn't there. Pneumo and hemothorax is much more accurate, 0.9 specific. So that means that if I present to you someone that has recently had trauma and they have absent lung sounds on one side, 90% chance that the pneumo-hemo is there. And it's 0.7 sensitive, so that's pretty good too. If you know for a fact on chest x-ray or ultrasound or whatever, the pneumo-hemo is there, there's a 70% chance you will be able to hear the decreased or absent lung sounds. What we should conclude from this is that abnormal lung sounds can rule in a problem. They can tell you there's fluid or wheezing or decreased lung sounds, but they can never rule one out. So make sure you're using this assessment the way it was intended to be used. Thank you for listening.